Ibuprofen is one of the most commonly used painkillers in the world. Millions of people take it every day for headaches, back pain, joint pain, fever, toothache, muscle soreness, and even common flu symptoms. It is cheap, easily available without a prescription, and generally considered safe. Because of this easy access, many people assume ibuprofen is harmless. They pop a pill without thinking twice. But what most people do not realize is that ibuprofen is a powerful drug that affects many systems inside the body. Its hidden effects often develop slowly and silently, and by the time symptoms appear, the damage may already be done. Ibuprofen belongs to a group of medicines called non-steroidal anti-inflammatory drugs, also known as NSAIDs. These drugs work by blocking chemicals in the body called prostaglandins. Prostaglandins play a major role in pain, fever, and inflammation. When ibuprofen blocks them, pain and swelling decrease, which is why the medicine works so well. But prostaglandins are not only responsible for pain, they also protect the stomach lining, support kidney function, regulate blood flow, and help the heart work properly. When ibuprofen blocks these protective chemicals, it can create serious problems over time. This is where the hidden dangers begin. One of the most dangerous hidden effects of ibuprofen is stomach bleeding. Many people believe that stomach damage only happens when a person feels pain or burning. In reality, ibuprofen can damage the stomach lining without causing noticeable symptoms at first. The medicine reduces the production of protective mucus in the stomach, making the lining more vulnerable to acid. Over time, this can lead to small ulcers and internal bleeding. Some people only discover this problem when they suddenly develop black stools, vomiting blood, or severe weakness due to blood loss. In many cases, the bleeding starts silently and progresses slowly, making it especially dangerous for older adults and people who take ibuprofen regularly. Another hidden effect of ibuprofen is kidney damage. The kidneys rely on proper blood flow to filter waste from the body. Prostaglandins help maintain this blood flow, especially during dehydration or illness. When ibuprofen blocks prostaglandins, blood flow to the kidneys can decrease. This may not cause immediate symptoms, but repeated use can slowly reduce kidney function. People who are dehydrated, elderly, diabetic, or already have kidney disease are at much higher risk. In severe cases, ibuprofen can trigger acute kidney failure, a condition that may require hospitalization or even dialysis. Many patients are shocked when doctors trace their kidney problems back to years of normal painkiller use. Ibuprofen also has a hidden impact on the heart and blood vessels. Studies have shown that long-term or high-dose use of ibuprofen can increase the risk of heart attack and stroke. This happens because ibuprofen affects the balance between clot-forming and clot-preventing chemicals in the blood. It may cause blood vessels to narrow and increase blood pressure, putting extra strain on the heart. What makes this risk especially concerning is that it can affect even younger people with no history of heart disease. Someone taking ibuprofen daily for chronic pain may believe they are managing one problem, while silently increasing their risk of a life-threatening event. High blood pressure is another overlooked side effect of ibuprofen. The drug can cause the body to retain salt and water, leading to increased blood volume. This raises blood pressure gradually, often without noticeable symptoms. Many people blame aging or stress for their rising blood pressure, never realizing that their daily painkiller may be contributing to the problem. For patients already taking blood pressure medication, ibuprofen can reduce the effectiveness of these drugs, making hypertension harder to control. Over time, uncontrolled high blood pressure increases the risk of heart disease, stroke, and kidney damage. Although less common, liver stress is another hidden danger of ibuprofen. The liver processes most medications, including ibuprofen. In some individuals, especially those who drink alcohol regularly or have existing liver conditions, ibuprofen can raise liver enzyme levels and cause inflammation. This damage often goes unnoticed because early liver problems rarely cause symptoms. Fatigue, nausea, or mild abdominal discomfort may be dismissed as minor issues. In rare but serious cases, long-term ibuprofen use can lead to significant liver injury. This risk increases when people combine ibuprofen with alcohol, a combination many do not consider dangerous. Another surprising hidden effect of ibuprofen is delayed healing. Inflammation is often viewed as something negative, but it plays an essential role in the body's healing process. When tissues are injured, inflammation helps deliver nutrients and immune cells to the damaged area. By aggressively reducing inflammation, ibuprofen can slow down muscle, tendon, and bone healing. Athletes and people recovering from injuries often take ibuprofen to push through pain, not realizing they may be prolonging recovery. Research has shown that frequent use of NSAIDs after injuries or surgeries can delay tissue repair and weaken long-term recovery outcomes. Ibuprofen can also mask serious underlying conditions. Because it reduces pain and fever so effectively, it can hide symptoms that would normally alert a person to seek medical care. For example, a persistent infection, appendicitis, or inflammatory disease may go unnoticed because ibuprofen keeps symptoms under control. This delay in diagnosis can allow the condition to worsen, making treatment more complicated later. Many doctors have seen patients arrive at hospitals with advanced disease because painkillers kept the warning signs hidden for too long. Another important issue is dependence on pain relief, not addiction in the traditional sense, but psychological reliance. Many people begin to believe they cannot function without ibuprofen. Headache? Take a pill. Minor discomfort? Take a pill. Over time, this habit increases dosage and frequency, raising the risk of side effects. The body may also become more sensitive to pain when the medication wears off, creating a cycle where pain seems worse without the drug. This pattern encourages long-term use, exactly where ibuprofen becomes most dangerous. Certain groups face even higher risks from ibuprofen. Older adults are more vulnerable because their kidneys and stomach lining are already weaker. People with diabetes, heart disease, high blood pressure, or a history of ulcers should be especially cautious. Pregnant women are also advised to avoid ibuprofen, particularly in later stages of pregnancy, as it can affect fetal circulation. Despite these risks, many people self-medicate without reading labels or consulting a doctor. It is important to understand that ibuprofen is not an evil drug. When used occasionally and at the correct dose, it can be very effective and safe. Problems arise when it is used daily, in high doses, or for long periods without medical supervision. Many people assume that over-the-counter medicines are harmless simply because they are easily available. This assumption has led to countless preventable hospitalizations worldwide. Doctors often recommend using the lowest effective dose for the shortest possible time. For chronic pain, addressing the root cause is far safer than relying on daily painkillers. Lifestyle changes, physical therapy, proper hydration, weight management, and alternative pain management strategies can significantly reduce the need for ibuprofen. In some cases, doctors may recommend safer alternatives depending on the patient's condition. Reading medication labels carefully is also essential. Many cold and flu medicines already contain ibuprofen or other NSAIDs. Taking multiple products together can accidentally lead to overdose. Symptoms of ibuprofen overdose include nausea, dizziness, confusion, and severe stomach pain. In extreme cases, overdose can cause seizures, breathing problems, or coma. In conclusion, ibuprofen is a powerful medicine that deserves respect. Its ability to reduce pain and inflammation has made it a household name, but its hidden effects can quietly damage the stomach, kidneys, heart, liver, and healing processes of the body. The danger lies not in occasional use, but in long-term, unsupervised consumption. Awareness is the first step towards safer use. Understanding these hidden effects allows people to make informed decisions about their health and avoid preventable harm. If this medicine is part of your daily routine, it may be time to pause and reassess. Pain is a signal from the body, not always an enemy to be silenced. Sometimes, listening to that signal can prevent far greater problems in the future.